Hi, I'm Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Usha Rajagopal, and we're talking about a couple different procedures today. First up will be Femi Lift, followed by beautiful eyes. Before we get started, remember, any advice we give you today, consult your own physician first. All right, let's jump right in. Dr. Usha, welcome. Thank you for joining me today.
Thank you.
Let's talk about Femi Lift. I have not heard about Femi Lift, so tell me what it is first.
Femi Lift is an intravaginal laser resurfacing procedure that is now in the U.S. It has been approved by the FDA for the last year or so. We've had it in our practice for about 6 months.
All right, so then, first of all, laser resurfacing, how does it work?
The way it works is it's actually intravaginal, so it's actually placed internally into the vagina, and the internal vaginal mucosa is lasered.
So it tightens everything in there?
It tightens.
Okay.
There are three main things that the Femi Lift does. First and foremost, it's really great for women who are having issues with dryness. So this could be slightly older women, postmenopausal women, and that's a big issue. Second could be women who, for whatever reason, are on an anti-estrogen regimen. So after you've had breast cancer, sometimes one of the chemotherapy is an anti-estrogen, and that can produce side effects too.
Wow.
Or women for any other medical reason who've had their ovaries removed early, they can have issues.
So they're good candidates. Who else is a good candidate?
So that's one group of patients. The second group of patients are women who want a little tightening of their vaginal canal. So this could be also women who want tightening because they have mild urinary incontinence.
Oh, wow.
Or it could be women who just want to increase sexual satisfaction.
Or had babies, right?
Oh, so for a lot of these, so for women who had the mild urinary incontinence, it's usually women who've had intravaginal childbirth. So that happens. Or sometimes if you want just a little tighter.
Yeah, you don't feel that there's that many, women with all those problems. You just think, oh, it's just after you have babies, but it can fix a lot of things that we didn't think about.
It actually can. And
it's fantastic.
And I think as it's been in practice more and more, doctors are finding that it has even more uses than we've already encountered.
How long is the procedure? How long does it take?
Yeah, the procedure is we usually recommend 3 treatments, 1 month apart. And each time the treatment is less than 10 minutes.
Oh, that's wonderful.
And it's completely pain-free.
Oh, that's great.
Yeah.
And so what about downtime? Are there any side effects from that?
No downtime.
Good.
The only recommendation we have for women is not to use any products internally in the vagina.
Okay.
So that could be tampons or intercourse.
Okay. So just don't use anything.
For 3 days.
Gotcha. For 3 days.
That's it.
Okay. It's not too bad. What about cost? Is this expensive? You have to do 3, you said. So what would be the cost?
So the cost for 3 is $3,500.
Okay.
And for most women, they usually pay up front before they have the treatments done.
Oh, okay. Now, when women get their last treatment done, when do they see the benefits? Or is it right away?
They see the benefits even after the first treatment. Within about 10 days after the first treatment, they can notice benefits already.
Fantastic. That is great. And do you need less treatments, maybe if you're fixing incontinence, as to say after childbirth tightening, or do you always need the 3?
You need 3.
Okay.
And some people may need more in the future.
Oh, okay.
But certainly to start out, we usually say 3.
So if you still have a little bit, you can come back and get another one done.
Yes.
All right.
Not at all.
And then for Femi Lift?
So Femi Lift, again, is also done in the office.
Okay.
And there's no anesthesia required, and it is painless.
And do you need a ride for Femi Lift?
No, you don't.
No.